I need to see you for your vaccines. It should be, I need to see whether your pet, that's number one.
Right, right. I mean, no matter what perspective you're coming from. So if it's a conventional vet, okay, you want to do a full physical exam, listen to the heart, look at the teeth and gums. There might be dental disease going on. There might be a heart murmur. There could be some joint issues, some
See whether your
patella
pet,
issues.
that's,
And really, we want to be doctors, not just vaccinators. And I tell clients, most of these vaccines that are the core ones are puppyhood diseases, like we discussed in our interview. They're not really diseases seen in adult and senior animals. So to continue to just jab them year after year or every few years, it's ludicrous. It's poisonous to the animal. It's harmful, and we have to get that message out there.
yeah, and it's not going back to fear. It's not just the fear of the client. It's the fear of the veterinarian, right? Being sued, making the wrong decision, losing their license, right?
Right.
So
Right.
there's really only one person that really totally has to know what the best interest of that particular animal is, because you don't know what decisions and why that veterinarian's making those decisions. It may not be for the best interest of your pet.
No, I mean, parvovirus is the best example. I mean, I've been doing this, Carrie, for 30 years. I haven't seen one case of parvo in any animal over the age of 1 who was either raised well, I did see a couple of holistic clients I treated with homeopathy, but let's just talk in conventional medicine now, who's gotten, let's say, the minimal vaccines at a certain age. They got adequate immunity or adequate antibodies. And I haven't seen any cases of parvo over the age of 1 in those situations. And so when these middle-aged, older animals come in with all these chronic diseases, and we're jabbing them with a virus that really is not at risk at all to them, zero chance, to me, that's criminal. It really is.
It always makes me think of chickenpox. Parvo always makes me think of chickenpox. Whereas, like, as children, you got it. I know as a child, I had 3 siblings. And then, so we all had our friends. And when someone got chickenpox, you all went to their house to get the chickenpox so that it could be done and it would be over and you didn't get it anymore. Exactly. I can't imagine if we would have continued giving our kids, we didn't have the chickenpox vaccine back then, but I can't imagine giving adults vaccines for chickenpox their whole life.
Oh, yeah, absolutely. I think that's one of the big reasons why we've seen a recurrence in shingles, because we're not allowing our immune systems to respond to the milder form of the virus, as the form of chickenpox, when we're young. And so, yeah, it's a very good analogy you brought up about it. The metaphor between parvo and shingles, and chickenpox. And I have to say that it's, you get cases like the one you just mentioned to me, where you have a dog who's had high liver enzymes. I don't know the history yet, but a lot of times people wonder, well, what am I doing wrong? I'm feeding raw. I'm doing things now holistically or naturally, and I'm trying to watch what I do. But if you look at the history of a lot of these animals, especially the rescue animals, you just see a barrage of immune onslaught, just tremendous amount of vaccinations, flea and tick medication, wormings every week or 2. And then you want to know why all of a sudden the liver, which is our main detoxification organ, all of a sudden you start seeing liver enzyme elevations. That's the result of chronic toxicity that occurs over time. And it just doesn't pop up overnight.
Yeah. It's interesting. I hope that Shelley comes on and we can talk a little bit just from what I know about Ziggy. I know she's been very holistic for a very long time. I can tell you it's been a very long time. It started, though, with, I believe, and we'll have to talk about with her, but when she first asked me about it, his liver enzymes were elevated, and that was, I want to say, 4 years ago. And that's when we needed him to lose weight. He was a little overweight, and so for 4 years, she has been very holistic. I guarantee you, no vaccines, no flea and tick meds, nothing. She's done nothing. She feeds a great diet, in my opinion. It may not be the right diet for him, which is what I have been
Right.
trying to explain to her. It may not be for him. He is
Sure.
getting up there in age, and we'll have to look at it. But it is something I want to do an entire podcast on, is liver enzymes. Because I guess while I'm waiting for people to come in and we get to some other questions, maybe I would ask you, do you think that age alone, if you took everything out of the equation, can age alone cause liver enzymes to be elevated?
Well, there's an old saying, Carrie, age is not a disease. Really. So I guess as we age, we're, depending upon our lifestyles. Now, obviously, in Ziggy's case, it sounds like he's had a good lifestyle. Although, was he a rescue animal when he was younger? Or was he,
I don't I don't know that yet. I
Yeah.
don't.
So, I mean, a lot of these damages are done before the guardian even has a chance to say, I want to do it holistically. And I tell clients that when they adopt animals from shelters, rescues, humane societies, those animals are literally poisoned. And you may not see the effects of that until they get older. Even with the raw diet, even with a natural lifestyle, those animals need, in my opinion, individualized energy medicine treatment to address those susceptibilities on a deep level, and functional medicine also, which is biochemical medicine. And what I mean by that, of course, is making sure the gut is healthy, making sure the diet is good, staying away from pesticides, common sense things. But a lot of these animals are so ill at a deep level from those early onslaughts that they get at these facilities, that they really need energy medicine to address the deep imbalance that's existing there. I do it with classical homeopathy and nutritional therapies and dietary supplements. Other colleagues do it with Chinese medicine and acupuncture, but you really need a deep system of medicine to address it. So I think when you ask, do these animals have aging, is age the disease? I really don't think that is. I think it's just their livers have just had enough, after all these years.
Yeah.
And it's been brewing in their bodies. It's stored in the fat, and from an energetic and a biochemical perspective. That's why I love homeopathy, because I watch so many changes occur with the right remedies, not only on an energetic level, but then you see the biochemical changes. The liver enzymes come down, the animals are doing better. They were on supplements before, the supplements are working better now. So sometimes we need a deeper system of medicine to really help those animals.
That's why I sent her to you, because she's just,
Well,
she's
yeah,
trying to get to this, situation. This is the love of her life. Not that all we all just love our dogs so much, but she's just
right.
struggling with. I feel like, I have told people I just lost a cat of 20 years, and
Oh,
and I
sorry.
I have had her since she was a baby, so she has been natural from the get go, and
Right.
her kidneys finally just gave out. Truthfully, we think it might have been something else that I wasn't willing to go do exploratory on a 12-year old.
Sure.
I mean, on a
Sure.
20-year-old cat. But it raised a question to me, like when I have heard and actually I've seen it, where different labs have different what is normal, right? Like this
Right.
in
Right.
this part of the country says this is normal and this is normal. So I often lately, especially with liver enzymes, have wondered if maybe there should be a different range for, not that it is a disease, but maybe there's a different range for a senior versus a puppy. Is that?
That's an excellent point. I mean, we have that for dogs with cats with thyroid problems. There's a different range. It used to be normal thyroid is between 1 and 4. Now the reports always say if we have an older cat with a T4 above 2.5, then you should suspect that cat may have a thyroid problem.
Yeah.
So yes, I agree that there should be an age difference in what's normal, what's not normal. In fact, one of the icons of holistic medicine over many years, the Goldstein family, who you probably know, Marty and his brother
Yeah.
Robert, they came up with a series of testing that they used to do where they wouldn't just analyze, is it in the normal range? They would actually analyze, they had a computerized system where they analyzed the blood work. And, if the liver enzymes were low normal, in conventional medicine, we're talking, hey, that's just normal on the bell shaped curve. Or if they're high normal, let's just say it that way. But that's not real. And then, most vets would say that's normal. But the Goldsteins in their testing would say, no, that animal needs liver support now before it starts to escalate into the abnormal range.
Right.
So I forget what the testing was called, but the
Huh.
Antec laboratories used to run their tests. I don't know
Yeah.
if it's still available since I don't really, I'm not really in general conventional practice much these days.
Yeah.
But I agree with you. Different ages, different breeds have different normals.
Yeah.
Greyhounds, as Dr. Dodds would tell you,
Sure.
greyhounds, sighthounds, King Charles Cavalier Spaniels. It's normal when you do a CBC in house to see very few platelets, and we have to understand those differences.
Yeah.
So I agree with you. I mean, there should be a varied ranges, not just one a one shot fit all approach to interpretation of lab values.
Yeah.
Yeah,
Well, biggest reason why I bring that up is because Ziggy has not had any symptoms. It, you know what I
interesting.
mean? I mean, he's fine. He does everything normal. It's just that every time she runs these liver enzymes, they're going up. But you guys can go over
Well,
that. But
that'll be interesting because as a homeopath, I don't know if you ever had a homeopathic intake on any of your animals. We really do ask all sorts of questions that really are not the typical traditional medicine questions. So we really dig into the case. And I'm not saying maybe she does have what we call in homeopathy a one-sided case. One-sided case meaning there's not much there but a dog with elevated liver enzymes who's clinically normal. But usually with in-depth questioning, I'm able to come up with a list of symptoms or imbalances, as we would say in the energy medicine world, that we can look at as helpful to us in prescribing homeopathic remedies to bring the body back into balance
yeah,
and
yeah.
lower those liver enzymes.
Well, that's why I sent her to you because I said
Right.
you have to see a homeopathy because this isn't. We can't keep doing this. I think the stress alone is not going to let I mean, it's stressful as a pet parent to go into a veterinarian and see that your pet's
Absolutely.
liver enzymes are raising, and you're looking at a dog who seems perfectly normal, and he's
Now there,
eating.
yeah, and there's no, and what she shared with me is there's the supplements she's on look like they're excellent supplements. The diet, as you said, I haven't looked at it yet, sounds very good. You have to remember the liver is this filter that filters out all toxins, and I don't know where she lives, right? She out west in California near
She
you.
just recently moved to the desert, so she's not by me. She's about 2 hours from me now, but
Right. But a lot of times these are toxic related. It could be something in the home. It could be
yeah,
something in the environment. Something in the air, the water. There's so many different variables. But even in those cases with homeopaths, we focus on the patient side of the equation. So even though they have these toxic stresses, we want to try and say, well, why is this animal reacting to these toxic stresses, and then give them energy medicines that help restore health and balance in the patient. That's what
well,
we try
I'm
and do.
I'm excited to kind of be a little bit on the outside journey with you both because I know Shelly will keep me in the loop a little bit, and I'm just really
Right.
excited to see the journey you guys go through together for Ziggy. So, let me get to some questions. So, Karen asks, "What do you recommend for middle-aged dogs who have issues, autoimmune disease, irritable bowel, and allergies with regard to flea and tick meds?"
Well, with flea and tick meds, well, the generic answer, which sounds like it's an idealistic answer, is we want to raise the health of those animals as best as we can so that they're less susceptible to attracting fleas and ticks. In other words, raising the vibration of the animal. And how do we do that in energy medicine? We prescribe with constitutional remedies based upon the symptoms that those patients have. In other words, if they're intermittent vomiters, they're intermittent missing meals, they have the little tear stains coming down there. These are all signs of hidden chronic imbalances in the animals. And so, if we can prescribe energy medicines, whether it's homeopathy or Chinese herbs, and my acupuncturist friends who do that, that's how you kind of become less attractive to the fleas and ticks. With that being said, there are a lot of excellent products out there. There are essential oil products that work very, very well. Many of my clients find the company Wonderside is a nice company that's a cedar-based company. Dr. Pitcairn in his book, he's my teacher in homeopathy. He has, some, remedies and techniques and that are very, very helpful. Diatomaceous earth is very helpful. The thing we have to keep in mind is that when we do natural flea and tick control, we have to keep on top of it. It doesn't have the residual effects that, let's say, the little pill has that lasts for 3 months, or the topical drops on the back that are, of course, pesticides and poisons. And so, we have to realize that when we treat animals holistically, it does take effort and guardian participation. So, people that live in Connecticut around all the tick infested areas, if they have an essential oil formula that works, that they find works, they're going to have to keep spraying those animals on a regular basis to keep those ticks away. So it's not like we have like some magic bullet that's just going to stop, an animal from, getting fleas or ticks. But the general answer is raising the health, starting with the gut, like you probably do with a lot of your clients, starting to raise the health of the animal through the gut immune system. That's from a functional medicine perspective. And then approaching it from an energy medicine perspective. That's what I try and do.
You know what's so interesting about this talk is, one, first off, people ask me all the time when I tell them I don't sell, I wouldn't recommend, I wouldn't suggest any of the toxic stuff, because I just wouldn't.
Right.
So then they say, well, what do you do for fleas? Like as if I'm living in a flea infested home.
Right. Right.
I have stopped saying that my dogs eat, not stopped saying it, but I used to be really like, my dogs eat a very healthy diet and I just don't have a flea problem. But they just kind of think I'm a whack job when I say that. But I will tell you how interesting this little subject is. I had just today 2 dogs come in, same family.
Mm-hmm.
Both of them are getting Advantage put on them every month. One of them had an infestation. I don't mean 1 or 2 fleas. I know what an infestation is. And I'm telling you, like when you wash them and the blood comes down from all of the little blood droplets.
Oh, yeah, sure.
An infestation. And I could not find a single flea on the other dog. Not
Right.
even, nothing. So it's interesting to me to think, now, one of 2 things, in my opinion, could happen. One, maybe the owner forgot to put it on the dog that had the infestation. I have to not think maybe she forgot to put it on that dog. But I really think that the dog with the fleas is having some health issues. And that is why the other dog has nothing and this one has this many. They both live in the same home.
Well, I use that. It's funny you bring that up because I use that as a metaphor all the time when I'm explaining how homeopathy works and what the basis of, health and disease is. Remember, Carrie, we always bring it back to the terrain of the patient. So if you get 4 animals in a home, or in your case, you're talking a few animals, I see that all the time where one animal can be loaded with fleas and not itch. You have another animal who has 1 flea on it, is itching his brains out. Then you have a cat who's going in and out of the house and has not any single flea on them.
Right.
That's because disease, and this is an important point to make to the audience, chronic disease always starts or at a susceptibility level, at a dynamic, energetic level. And I know that may sound a little woo-woo to some people, but I like to use as another analogy with that. When I was a young boy and I lived in Long Island and I would go to baseball games in some swampy areas of Long Island out on the island, I would always be itching with the gnats and the mosquitoes. My brother would be sitting next to me and he would be like, he wouldn't have it, he wouldn't be itching at all. And parents would say, you're just juicy for the mosquitoes. They like you. You're tasty. Well, it's not that my brother's not exposed. He's not susceptible on an energetic level. So when we linearly try to explain it away, when our egos try to go to a place that it has to be like a linear explanation, and you've probably heard me say this before, maybe not, but in my energy medicine talks, I always talk about health and disease always starts at the energetic level and it manifests in the physical or the biochemical level. So that's why I try to go deeper in cases like that. It's not that happens in every home, but as another example I can give is, how many times have we seen animals have worms over and over again? And then what happens is they go from one wormer to the other wormer. Then we're going to do panicure. Then we're going to do this one. We're going to do that one. And then all of a sudden they say, well, we must have resistant worms. That's the problem. No, the problem's not the worms. The problem's the patient. The patient has a weakness, a susceptibility, and our jobs as holistic practitioners, whether we're a functional medicine doc or whether we're an energy medicine doc, is to raise the vibration and lower the susceptibility of those patients to attracting the hookworms in the first place.
Right.
And that's
Well,
how we get rid of them. Yeah.
well, it's interesting even that Karen has an animal who she's saying has more than one problem. We have autoimmune disease, irritable bowel, and the dog has allergies, and the
Right.
dog has fleas. So, I mean, the answer's kind of in the question when you think about it, right? It's
Right.
just
Right.
you have an animal who's sick, and the fleas are attracted to that. They're parasites. They want
They're
to.
parasites.
They
Exact.
want.
Good point. Excellent point.
They're going to feed on the weak, and
Right.
that's where they're going to go. So it's just
And you know, we have to raise the vibration of as best as we can, no matter who she's working with. Hopefully, a good holistic practitioner that's working on that on those conditions. But you know, it's difficult, and it takes time and patience to lessen, to raise vibration, to lower the susceptibility. And there are so many clients out there, Carrie, that I'm not saying this is this particular one, who will go to the raw diet and they'll start feeding a raw diet. And I said, well, I fed that to the animal, but it didn't work. I mean, it didn't, I tried that. It was, he didn't eat it or he got worse. And then you find out they're also putting the flea and tick medications on the back. They're doing the wormings and they think the raw diet is a failure or they're vaccinating when it's
yep.
not that. It's the whole enchilada, you know, that you have to look at.
It is really, really hard. I spend so much time speaking about nutrition, but if you really want to talk with me about nutrition, I make people do a sit down because I don't want you to come back to me next month and say this raw diet thing didn't work when you're still doing flea and tick and heartworm and dewormers and all of these other things. So I have to go over it with them. Look, if you want to go down this route, you need to do all of it. Diet can't work alone. I can't eat healthy and still smoke and think,
Right, right.
well,
No,
I
it's
eat
true.
healthy, so how the heck did I get lung cancer while I'm puffing away on 12 cigarettes a day or a
Right.
pack or however many people smoke? I don't know.
And not to broaden that further, but I know we're focusing on the animal part, but there's this intimate connection between the guardian and the animal too. So a lot of times our animals are mirroring our issues.
Yes.
So, you know, whether it's, you know, endocrine or hormonal diseases, autoimmune diseases, liver problems, you know, in Chinese medicine, they look at the liver as the seat of anger, you know, so sometimes the animals are just reflecting something that the guardian is experiencing. And so, you know, there's that intimate connection. And some of my colleagues, you know, that do homeopathy, they won't even treat the animal homeopathically, energetically, unless they're also treating the guardian. So there is this connection between the guardian and the animal that sometimes we have to be, well, we often have to be aware of because our animals are really here to be our teachers, our unconditional lovers, and you know, love us in such an unconditional way. And sometimes they're here to show us something. Well, I hear my animal has liver disease and this and that and all the other things, but maybe there's something going on that I'm doing that may be reflecting that. You know, like in any relationship, right? Whether it's a
Yeah.
husband and wife, boyfriend, girlfriend, whatever it is, employer, employee, it's a two-way street. So sometimes our animals' issues do relate to the guardians. I can't tell you how many times I've had clients come to my home office with grocery bags full of supplements and raw diets and this and that. And they're the ones constantly getting the animals with not, you know, these particular people, not commonly, but you know,
Right.
they'll be the ones that'll have cancer and the immune problems and all that. And then I'll get another client who goes to a vet, an old time vet who vaccinates every year, but and they're walking around in a carriage and they're emotionally balanced and they love their animals. They don't have this intensity, this anxiety. And you know, those animals are healthier, even though they're being raised allopathically with all these toxins. So we always have to look at the relationship between the guardian and the animal as well. I think we can't lose sight of that.
Have you ever, I have, and my dad is one of these people this happened to, and I've heard it happen in a few of my clients over my 37 years of working, but have you ever seen an animal come up with, my dad's case is his dog got this crazy weird boil-ish thing on his back, and my dad had one on his back, same
Wow.
time, within days. I mean,
Right.
I don't know if you've ever, it was the weirdest thing. And they were these two, my dad, and this dog has since passed, but these two were, my dad's retired. He's with that dog 24/7, did everything with him. And both of them end up with this weird thing on their back.
Well, I
That,
don't want to become, I don't, and again, that's Hahnemann, the father of homeopathy, Samuel Hahnemann, describes that disease is always transmitted dynamically or energetically. Now, I know, again, that might sound a little woo-woo to people, especially during the times of COVID and germs and this and that. But I will say that that is, disease is not, the germs come secondary to the unhealthy terrain. So, for example, I happen to be susceptible to flea bites. If I'm around flea bites, I mean, fleas, I will start itching my ankles. And if a dog is across the room that I know, Dr. Demi's here for fleas, I mean, a flea problem, and the dog has fleas all over him, I will literally, the dog could be across the room. I'll start itching my ankles, and there'll be bites on my ankles, and I haven't even gone near the animal. Even I know fleas jump a big distance, but that's what I mean by dynamic transference of
yeah,
disease. So to bring back to the question you asked, I think there was a relationship between your dog and you said your dad, that had similar lesions, a boil on their back and that kind of thing. That happens all too commonly where animals do, and that goes back to how disease is transmitted, the basis of health and disease, which as a homeopath, I look at it at a deeper level and it's an
yeah.
energetic level. Yeah.
Yeah, and it just, I wish there was more of you around. I wish you would move to California. I had a client today who called me. She listened to the podcast and she says, "What can we do to get Dr. Dim to move to California?" I said, "I don't know, but I'll ask him." So there, I'm
Oh,
saying,
wow.
we think
You
you should.
guys have, how is it out there in California? You got all that on,
We got a lot going on,
a lot going on. Yeah.
but what we don't have going on is homeopathy veterinarians. We do not
I
have,
know.
we just don't have it, at least not in Orange County. We have some holistic veterinarians, and we have some veterinarians who do, just recently we have one that started doing ozone,
Right.
but we just don't, it, the distance is pretty far. So we've got Orange County and then LA and then San Diego. We've got a little bit in San Diego. I don't know if you know Dr. Katie Kangas, but she's in San Diego.
Oh, okay.
And then we've got Dr. Palmquist in LA, but nothing
Oh,
in,
of course. Yeah.
yeah, but
I know
nothing,
Richard.
nothing in Orange County.
Right. And
So,
well, the other problem is a lot of conventional vets are taking holistic courses,
oh
but
yeah,
they're what Dr. Pitcairn calls eclectic vets.
yeah,
In other words, they kind of use a little bit of this, a little bit of that, but when push comes to shove, it's antibiotics, it's Hill's prescription foods or Royal Canine, it's
exactly.
vaccinate, so that's the hard part to find a true holistic vet for sure.
It's actually making it worse, in my opinion.
I think
I
so.
it, for a while, and he has since moved on because Banfield bought his practice, as Banfield is buying all the practices, it seems.
Right.
But for a while, I started referring my clients to a conventional veterinarian, and they couldn't understand why. And I said, because if you walk into a conventional veterinarian and you know he's conventional, you
Right.
can get all of your tests, and you're in your heart, you'll know he's conventional, so you won't just jump into everything he says. But if I send you to the holistic vet down the street, everything she tells you, you're going to have your guard down and you're going to do everything she tells you to do, because
Right.
it says she's holistic on the door. And plus, I thought Dr. Andrew, who was the conventional vet that I was sending to, I thought his integrity, his was right. Like he may not understand holistic or homeopathy, but he wasn't there to just get you in and out the door. And
Right. He practiced with principles.
he did, and
Right.
those were
Right.
his
Right.
principles, and I support that.
Right.
Until we're all dead, I always say, until we're all dead, I don't think any of us absolutely know for sure. And I know what I believe, I know what I think, I know what I read, and in my heart I believe, but I don't know, when I die, maybe I'm going to find out I'm stupid.
Maybe we'll find out it's all different, right?
It's
Maybe
all
when we
different.
maybe when we have that final check, at the pearly gate,
Yeah, they're like, what were
yeah,
you thinking about this one?
right,
It
right.
makes sense, you know?
I mean that, but I've really evolved to really see the deeper basis of reality, which is
Yeah,
in the unseen, Carrie. I mean,
yeah,
just the fact that whether someone, someone also, asked me, how did I really become a believer in homeopathy? Well, when you see the little dilute remedies that are made from sugar pellets and stuff that's so below what's physically there of the original substance, and
yeah,
you give it to an animal and you see these tremendous symptom responses, that's not a placebo effect. The animal's not a placebo. It's actually responding and it's getting better and lesions are going away. So that really taught me that the
sorry.
basis, that's okay. The basis of our health, of our bodies, of our health when we get sick is in the unseen. And so, yes, we have to lead good lifestyles. We have to not put poisons in our bodies. We have to not over vaccinate. We have to not, eat processed foods, whether we're human or animal. Hopefully, not prescription foods if we're people.
Hopefully.
And just understand that it's life's a balance. We don't want to be too extreme either, but we want to live our lives according to good principles. And
Yeah.
I think that's what you described with your conventional vet. Is I have such utmost respect for vets that practice conventional medicine in a systematic, sensible way. And they're few and far to find, but I respect that veterinarian more than I do someone who's throwing remedies at animals and
Yep.
drugs and you've seen those type of holistic
Yeah.
practitioners, haven't you?
Yeah.
Yeah.
That's why I say I think they're doing more harm than some of the conventional veterinarians, because
Yes.
they're they don't know what they're doing and they're throwing a bunch of stuff. Milk thistle is my favorite. They carry milk thistle, so therefore they're holistic. I don't
They carry
understand
milk
that.
thistle, right?
Yeah, I carry milk
Well,
thistle. Here, I have this, so they just throw it at a dog.
here's the Denamarin that I got from the drug rep.
Right.
Right.
Exactly. But then what happens is it doesn't work. And then
Right.
the client goes, holistic medication is just a bunch of hoopla. And
Right.
so in that respect, you're doing more harm than good. So
Absolutely.
that's why I've been seeking out a lot more homeopathic veterinarians, because I think that's the level that I'm more comfortable with, knowing they understand about holistic. We're not just going to throw milk thistle and say, here you go, all's well,
Right.
and you know.
Right. The
But
only
yeah,
thing about homeopathy that I want to stress to people is that what makes you a real good believer is not only these miracle cases sometimes, but is to use homeopathy in acute situations, injuries, trauma, poisoning, when you get food poisoning, if you're drank a little too much and you're hungover,
yeah.
the remedy Nux vomica will bring you around a lot quicker than a cup of coffee often. And so
Wait, I'm sorry. What was that?
the remedy Nux vomica will bring you around a lot quicker than
Okay, let me write
coffee.
it down real quick.
Write it down right. And so, homeopathy in an acute disease situations, in those situations, works amazingly. I worked in a clinic, in an emergency clinic, where I was seeing patients, several an hour. A bulldog would come in with heat stroke. The dog would be, 108 fever. It's panting. It's blue. By the time the technician gets the catheter in and the IV fluids going, I've got doses of belladonna, which is a homeopathic remedy, already on its tongue. I've repeated it in a few minutes. And all of a sudden, the temperature's gone from 108 to 104 in a
Wow.
matter of seconds, a matter of minutes. So in an acute situation, homeopathy can be so amazingly fast. But the problem, not the problem, a limitation of it with a lot of these cases, the autoimmune disease, the chronic feet chewing dog, the skin itching, the inflammatory bowel disease, the seizure patients, homeopathy works much slower. And so we do lose some of our clients sometimes who don't have the patience to
Right.
work through that. And that's when I support the body with functional medicine, with, again, appropriate supplementation, not over supplementation, while allowing the remedies a chance to work. in a patient.
Yeah, that's the hard part with pets, is that usually by the time a pet parent, I mean, for someone like, I think even me, mostly you, we can recognize the signs before they're too serious, right? I
Right,
would
right,
recognize if your dog has a flea infestation, something might be going on, and
right.
start to adjust it then. But most pet parents, by the time the pet is to a certain point, we don't have much time to fix it, and homeopathy takes time.
It
So
does.
that's the problem. And so you get a lot of people that say it doesn't work. What we really need to focus on is these, from the start, setting them up for success, which, as I say all the time, like, homeopathy is great, and thank God we have it, and we have veterinarians like you and Dr. McCarran actually on the show. I just did an interview with him, and his we went over the whole history on
That's
homeopathy.
great. He's wonderful, isn't
He's
he?
such a great, I hate to say
Yeah,
storyteller, because people think stories aren't always true, but he really
he
gets
is. He's a
to
great.
this.
Yeah,
Yeah, he just gets into the story of how homeopathy started. And i
right,
I told him, I said, I've always been afraid of homeopathy because I really bad at algebra, so I just I see the
right, right,
x's and I start to go, I can't do that. But
right.
I think that's the problem, is we have to be patient. We have to be patient with anything. Just like, I can't eat junk food my whole life and then eat a carrot one day and go, why am I not feeling better? It takes time. We have to get
Right, right. The
um
toughest cases are those skin cases that come in. Those are the ones that the people, they're at their wits' end. They're
yeah,
keeping them up at night. They're chewing, they're biting, they're scratching, they're licking, and those take time. And if you hit the right remedy, it sometimes you'll have a miraculous response. But more commonly, what I see, Carrie, is gradual improvement, up and down, zigzag, a little bit increase, decrease. And then eventually, gradually, all of a sudden, the client says, he's not itching as much as he used to, and he's not getting as many ear infections. But that's the perspective you have to take when you're using homeopathy with chronic disease. It's not going to shut off the seizures. It's not going to shut off the itching. If it does, then it's not really holistic medicine. You might as well stick with Apoquel and Cytopoint, because
yeah,
that's what shuts down the itching,
right,
or cortisone. So it takes education of the client, and it isn't for everybody.
yeah,
I screen my clients, and I'm able to tell rather quickly when, if an animal is really in distress, and I honor the client's emotion. I mean, it's their baby. And if they're at their wits' end, or they're suffering from anxiety or stress, sometimes I'll direct those people back to conventional medicine, because I think it's best for them and best for their animal.
that's for the
And
animal.
yeah,
Yeah, I
yeah,
love you had said that in the podcast, and I love that you said that, because ultimately we have to help the animal. And even though I'm not a
right,
veterinarian, there's times where I have had to tell my clients, look, the stress that this is causing for both you and the animal, and I've got a 13-year-old dog in front of me that I want him to be comfortable. He, I can't, it's not going to work. It's just not going to work.
right,
So
right, right.
I've had to
So I
do,
mean, yeah, so you have to be aware of that.
yeah.
And
And
the
really,
other one I see sometimes is very common. I have one I have to call back tomorrow. It's a skin case in a young Newfoundland, and they're like, the husband wants itch relief now, and he wants to go back to the other injections, and the wife just wants to stick with it. And we get that a lot in,
yeah.
with our animals, where the husband and wife, or the boyfriend and girlfriend, or
Oh, yeah.
the two significant others, or not in agreement over how they want to treat the animal either.
Yeah.
That's also an obstacle to cure.
That's a huge, I get that with the haircut. Mom wants
Oh,
it long, dad wants it short, and they're in a fight in my lobby. And I'm like,
they're
this is
fighting
the
their lobby,
haircut.
right?
They
Poor
get even,
animals trembling. Yeah,
oh my gosh, the poor animal. And I'm just like, how about we do half the dog this way? Like,
I hear you.
poor animal. But okay, so Janice asks, she said that she has called a holistic vet, but I was not given an appointment because my pup does not have a medical issue. I assumed holistic vets would also do preventative management. Should I wait until she has an issue besides tear stains to seek treatment?
No, I would recommend you go call another holistic vet.
Yeah,
I never heard of a holistic vet turning away a client who wants to just make sure they're doing things right, their husbandry is correct. The tear stains are a sign of an imbalance. As I said, they're not easy to get rid of, and quickly.
Yeah.
But I have seen them go away in a lot of cases where animals are eating processed, prescription food and getting a lot of toxins. You put them on a raw diet, and all of a sudden the tear stains do go away. But that's not every case. But in this particular situation, I would look for another holistic vet. I just got something similar like that, where I just got a call today or an email from a client who lives here in Wellington, Florida, and said, in November, Dr. Dim, I'm getting a visa from a, 4 generations back, non-vaccinated, raw-fed, you know, totally holistically reared animal. Can I become a client, and should I come see you? And I said, absolutely. The early visits are the most important. When they're puppies, we want to go over husbandry and care, and a lot of times people think they have the knowledge and they really don't. And so, yes, I think for someone that wants to just make sure their animal is healthy and they're doing it well, again, when I ask my questions as a homeopath, the symptoms I'm often able to elicit. So all of a sudden, what becomes tear stains only becomes other minor issues that we want to get on top of. So definitely see another holistic vet.
Yeah, it's kind of concerning to me that a holistic veterinarian, or any veterinarian, would say wait till there's a problem. I think that the
It makes
job
no sense. Makes
makes
no
no
sense.
sense. It
No,
seems to me that their job, and especially one that's claiming to be a holistic veterinarian, knows that the whole thing is prevention. That whole thing
exactly.
is their job should be to keep you out of their office, not just every time your pet gets sick to come in
That's
there.
funny. That's what I tell all my new puppy clients.
Oh,
I say, I just want to see you once or twice, and
yeah,
then maybe do a wellness visit at a year of age. And
yeah.
I don't want to keep seeing you. They're so used to coming in every 3 weeks and every
Oh,
4 weeks for the shots and the
I
whole
know. I
nine
see
yards.
that. I
You
see.
know,
It used to be that you saw your groomer more often than your veterinarian. And I'm telling
right?
you, people come into me that I haven't seen in 6 weeks, and they've seen the vet twice already. And I'm like, this is not right.
And
This
each time they see them, you know what they're doing.
I know exactly what they're doing. I am
And
so glad you brought up tear stains. I like so there's a see if there's a couple more questions coming in, but I, of course, as a groomer, everybody wants me to get rid of the tear staining, with my magic wand that I only
right,
bring out on special occasions.
right,
But I continually tell people tear stainings, because I've had people go, well, they don't really bug me that much. They should,
right.
because it's a sign of something, more. But my question to you is, have you ever heard, and so when I do my nutrition consults, I always tell them, go to these vets, the few vets that I can send them to, and like, get me a blood test. I want to know what your levels are. Like, what are we looking at? I'm not going to, if you have a diabetic dog, I'm not going to put you on, this and that. So anyway, and so I have had some dogs come in with tear staining, and their iron levels are too high. And so
Interesting.
we put them on a lower iron diet, and the tear staining will go away. Have you ever seen that or heard of that?
No, you just taught me something, so
Yeah.
thank you. I mean,
It's
I
not every
didn't.
case. It's certainly not
Yeah,
every case, but I could tell you it's quite a few, and it makes sense when you think about the tears and where it comes from, and iron and the color, right? Because it's always that rusty color. And
right.
so I had read that years ago, and from a veterinarian, and I kind of thought, that's interesting. And then when I started looking at more blood work, I started having people run it, and we would just
Wow,
take them
that's
off
so
of
interesting. Yeah,
very.
I have to start to look for that.
Yeah,
I
it's
mean,
interesting. I'd love to see someone do a study on it. But it's also interesting because if you think, if they take them off of like a beef and put them on like a turkey,
right.
and then people think, oh well, I switched his diet. Well, maybe it wasn't just that you switched his diet; it's that you switched him
The
to a
iron,
lower
lower iron.
iron diet, right? So
Wow, that's really. I mean, when I was first in vet school, they used to teach us that those were clogged tear ducts,
yeah,
and then they would flush them out, and then they would look better for a minute and a half, and
yeah,
then they would come back the next week. So that
yeah,
was a bunch of bull garble. That it was clogged tear ducts that
yeah.
is why they
I
have
have
the
told
stain.
people, look at, there could be, a eyelash that's causing them to maybe blink
Yeah,
more.
there can be, sure,
So
mechanical, absolutely.
yeah, and so I've said, there's things that you want to look. I will give you a little, I don't know, Marcia says she gives filtered water, not tap water, no tear stains. I've heard that also, which is interesting.
Yes.
Some water has a lot of iron in it.
Oh, good point. Again, that's excellent.
Yeah, so
Thank
because
you.
I've heard that too, and I'm like, different
Yeah.
parts of the country, their water might have higher iron in it. So
Higher metals, sure. Yep.
yeah, so it's kind of an interesting little thing. Brian asks, joining late, so not sure if you addressed this, but how, if what we know about vaccines for our animals apply to us humans as well, specifically multi-vaccines at the same time, vaccines when you're sick, and boosters when you still have immunity.
Boy, that's a lot of questions
I
in
know,
there.
Brian.
I mean, it's like, yeah, I think, Brian, you're asking about vaccinology, and to answer it in a minute. Basically, in a nutshell, most of the viral vaccines that we give our animals, and even the core viral ones that they used to give only to children, when I say used to, the old days, the MMR, the DPT shots, and all that, the immunity lasts a long, long time. For in children, decades, and animals, it lasts years, if not the life of the animal. What we found is that the more components you put into the animal at once, in terms of combinations, the more likely you were to have reactions. Even though I know he's controversial, but I love his work, and I think his research was right on the money for his subpopulation that he looked at. But Andrew Wakefield, a very brave soul, um, was a gastroenterologist who had parents coming to him that would actually tell him, my children were doing well, and then they got their MMR shot, and then they became autistic. And so what he studied and found was it was not the it was not the it was not the single measles virus that was causing a leaky gut and signs of autism because of the toxins absorbed from the gut. It was the MMR altogether, the measles, mumps, rubella. So viruses, when we give them in combination, seem to have a worse effect on our immune systems than we do it, in single components. And I think, a lot of holistically oriented people in the vet profession and immunologists and people like Gene Dodds and Ron Schultz have always recommended less at once. So I think I covered some of his answer.
Yeah. No, I
I
think
mean,
he did.
to the
I think
most part, yeah.
that's what he's mostly talking about is these Dr. Dodds calls them combo wombos, you know.
Combo wombos, right?
Yeah, and
Exactly.
they were created as a way for it to be more convenient, and then they sold it to you as a way of it being less painful to your dog. They only have to get shot once.
Right.
So
Yeah,
so they've
exactly.
got you both ways, right? It's convenient for you, you don't have to come back, and we're not going to hurt your pet. And so people thought these veterinarians were doing the better service than the veterinarian that was saying, like Dr. Dodds will say, I'm not going to give you a combo wombo, you're going to have to come back.
Right.
And convenience, I say it all the time in nutrition, convenience, you can't find health in convenience. The more convenient it is for you, the less nutritious it will be. And
Right. And
that's
you know what
just,
they're doing now with the drug companies? They're coming up with, I see when I rarely watch television, Simpirica Plus, which now has heartworm, flea and tick, and worming. And so the drug companies are moving away from the wombo combos, and because people are now catching on to it, and now they're focusing on parasite control in
Jesus.
terms of wombo combos. And
Oh
that's
my
just
God.
all, it's all the same,
Yeah.
it's just
And what's
toxic
really
mess.
bad about that is sometimes your pet, like maybe you're in an area like, I don't know, the north or something, and you're not going to have, it's too cold. Maybe you're in Alaska and you're not even going to be exposed to fleas. It's too cold up there. So you're getting this combo wombo something because two of them your pet might get. It's
Right,
and how about the longer lasting, right? It used to be flea and tick
right.
stuff every month. Now big commercials are, oh, it lasts for 3 months. I'm like, oh, great, it's stronger. It's awesome.
It's stronger, right? And it's stored
Stronger.
in that, right, right. And they're exposing themselves to these pesticides
I
because it
know.
sits in the skin, it sits in the hair follicles.
I know.
It's just a shame.
I
Yeah.
know. Well, we're coming up on our hour of time that we've taken from you, but I just real quick, since we talked about tear stains, I just want to give everybody a little tip on tear staining that you can help get rid of naturally. If you get raw unpasteurized goat's milk, I know it's gross, and you actually drench the tear stain with the goat's milk, and you do that every day for about a week and a week and a half, it will get rid of the stains. But as Dr. Dim has pointed out, there's a bigger problem that you have to address and finding
Right.
out what that is. But in the meantime, if you saturate those tear stains.
That's a great suggestion. You've taught me a lot about tear stains. You mean, I thought you're not going to just mention angel eyes?
Oh, oh,
I'm
oh my
sure
gosh.
you get people that come in and ask for that, right?
No, yeah, since you brought that up, if you got a minute, I'm going to tell you all something
Yes, I
interesting
have a
about
minute.
that. So I had this client I still have her. She's a great client. And if she's listening, hopefully she won't hate me. But she had this dog that had these chronic yeast infections in the ear. They would kind of sort of go away and then they would come back. And then she said, you know how it does, back and forth. Get the pack put in the ear and go on. And I had her on a very good non-starchy diet, and I was trying, and it just kept coming back. And I kept asking her, you're not giving anything else, right? She's like, no, I don't, the whole list of stuff that I would go through. But damn, if they would just keep coming back. And I was getting so frustrated because I'm pretty good at knowing the route I got to go for yeast issues.
Right.
But I was at my wit's end. And then, of course, finally they say, oh, we think it's chicken. She's allergic to chicken. And I got to admit, I almost gave up because I was like, I don't know what I'm doing wrong or what they're doing and not telling me. I don't know. One day she comes in and she says, where's that stuff for the tear stains? I said, what stuff? And she goes, that stuff that you give for the tear stains. I go, I don't have, the only thing I have is the goat's milk that you put on the tear stains. No, it comes in a little powder. And I looked at her and I said, how long have you been giving this dog antibiotic angel eyes?
Right.
And there was my answer. And there was my answer.
Yeah, people don't realize it's an antibiotic that you're giving every day that just decreases the pigment, and it's an abuse of antibiotics.
Now that's in my, when I tell people no dewormers, no, I have to say, if they have a little white fluffy dog, I have to say no angel eyes, no, everything you put in can have an effect. You can't just say, oh, well, I only give him dog biscuits, for breakfast. It matters. So, but anyway, yeah. Real quick, just so we can get one question out to you. I heard there was a difference in liver ranges as a dog gets older. Oh, she must have, Mari, I don't know if you missed, we had what would be the liver range for a 15-year-old diabetic dog?
Well, off the top of my head, I can't give you an exact number, but
okay,
it would probably be, up on the upper range. It would definitely be higher than, the higher range. ALT in the, I don't know, 80 to range, 80 to 100, somewhere in there. I'm guessing.
Yeah.
I don't memorize those numbers.
I guess a better question for you, and we kind of touched on a lot of this in the very beginning, Mari, so make sure you watch the replay. But I think the better question would be, is there a difference in the liver range for a 15-year-old non-diabetic dog versus a 15-year-old diabetic dog?
That is a good question, and the answer is yes.
Okay.
The liver responds to all sorts of other conditions in the body. In fact, I'll never forget, I went to a lecture on liver disease, and the first slide that was put up it showed an animal's liver enzymes and their blood results, and it ended up that the liver enzymes were elevated not because the liver was diseased, was because the animal had severe dental problems and had plaque and infection in its mouth and all of that. And once they took care of they cleaned up the mouth, the liver enzymes returned to normal. So when you have a diabetic animal, they're going to have higher liver enzymes than an animal that's that age that's not diabetic. Same principle.
Yeah. Dr. Dim, we're going to let you go. It's late where you are, and like I told you, we don't have a lot of homeopathic vets out here, and we have listeners from all over the country. How do we get a hold of you?
Well, they can go to my website, which is drdim.com. That's DOCTORDYM.com, all one word. I prefer to be contacted by email if possible. It also has my phone number for my consultation line. And I work with people all over the country.
Amazing.
Not just here in South Florida. Homeopathy, we can practice everywhere. My homeopath I used to use was in Montreal, Canada. And I recently found someone local that I like that I'm going to. But definitely distance should not be a problem.
That's awesome. Yeah. And whenever you're ready, Orange County is waiting.
All right, Orange County.
I could put your practice right in the same area as mine, and I'll just direct everybody right across the parking lot.
All
So,
right, that sounds great. I
yeah,
have to think about it. You got me thinking now.
there is not. I'm telling you, you would
Yeah,
be very busy. I already have one client who says, "Tell him when I'll sign Boo up right
right,
now." So,
right. All
all
right,
right,
it's been great being on here, Carrie. Thank you for
yeah.
having me.
Take care,
All
and
right.
have a good evening. Good night, everybody. Thanks for
Good
joining.
night, everybody. Thank you.
Bye.
Bye.